Welcome back. We're making this recording in the midst of the COVID-19 pandemic lockdown. Today, April 20 of 2020, there are 245 confirmed cases of COVID-19 in the US and 40,690 deaths. And the end is not even in sight. So this video will give you some of my own experiences in a more visceral sense in visiting countries at the beginning of this epidemic and then pandemic. And I begin here with a first slide with a quote from the famous philosopher Forrest Gump.
Are you stupid or something?
I'm as stupid as a stupid does.
Now by stupid, I mean here a particular type of lack of education or unawareness, which is innumeracy. The lack of understanding of numbers and their relationship to each other. Simple functions, simple math. In this case, it's dramatized, of course, by a very urgent fact, namely, any delay in what we do because of this misunderstanding or our innumeracy will result in death or additional death that we had not anticipated and could have been avoided. So in the next video here, I give you a clip of an example of exponential growth. Famous story goes that the inventor of the game of chess was invited by his king, who was delighted by this game and its many possibilities. And he asked the inventor, "I'd like to reward you. What would you like me to give you?" So the cagey inventor said, and he was aware of exponential growth, of course, being a mathematician and game designer, says, "Well, give me one kernel of rice on the first square, 2 on the second, 4 on the third, 8 on the fourth, and so on." And the king says, "Sure, no big deal, it's just a little rice." So I show you this video and you will see what happens. We're back from the video and you have seen the power of exponential growth. Now, instead of kernels of rice, you can use infection. How many people will I infect if I carry the virus and I'm able to transmit it to other people? Let's say I can infect 2. Then those 2 can infect 4. And those 4 can infect 8, 16, and so on, identical to the exponential growth rate that we have observed in the previous video. Now, if the exponential rate is only 1 and I can infect only 1 person, then the level of infection will be steady and will not grow. If it's less than 1, let's say 0.8, then the infection rate will decline over time. So, as the early phases of this phenomenon began to occur, we went to China to investigate for ourselves what might be the early reverberations as the early signs of this new pneumonia called COVID-19 by the SARS-2 virus. What would it look like in China? And we arrived a few days before Spring Festival. Spring Festival is Christmas, New Year's, Labor Day, all rolled into one in China. Everybody goes home. Everybody sees their parents. The country shuts down for 7 days or more to celebrate New Year, the Chinese New Year. Now, by the time we arrive, millions of people already had left the city of Wuhan to travel to their ancestral homes to meet their moms and dads. And the consequences, of course, were profound. So here is a shot of the city of Foshan, close to Guangzhou, close to Hong Kong, across the river there. And you can see there's a sign for the Spring Festival advertising it, and the streets are totally empty. People stayed in their homes already. In the next slide, you see me here with a face mask. And I need to point out to you, as I was walking around in Foshan, everybody was wearing a face mask. In fact, it's hard to find a picture of a Chinese city these days where people are not wearing a face mask. So after we arrived 2 days later, the Chinese government put a quarantine around Wuhan, an essential lockdown. In the next few days, the quarantine was extended to more areas around that province. So, we then returned from China just in time because our president introduced a travel ban. And of course, everybody had to go home around the same time. It was impossible to get a flight directly from Guangzhou to San Francisco. We had to go via Taipei and Taiwan to be able to return. And as we arrived in February 1, this is the scene at San Francisco Airport. Now, if you want a scenario to most efficiently transmit a virus, this is the ideal scenario. Put thousands of people into a confined space and keep them there, breathing into each other, laughing, coughing, sneezing for 2, 4, or 6 hours, and you will guarantee effective transmission of the virus. So that was our experience in China. Now, how about Europe? We went to Switzerland, to the city of Zurich. And here you see the Zurich Opera House on March the 8th. Much was known at the time already about the spread of the virus. In fact, cases had already occurred in the southern part of Switzerland, bordering on Italy, which, as you know, had a massive explosion of cases early in the pandemic. We will get back to Italy in a little while and discuss in more detail why this happened. So here we are, and you see quite a few people lining up. We were among them. What possessed us to do this? Well, denial and the low infection rate at that time in Switzerland. I will now show you a video that shows a little aggregation of happy people around the Opera House, celebrating with some music, showing little concern. You don't see anybody there with a face mask, as I can see, in apparent denial of what might happen. Here is the inside of the Opera House. It seats usually about 1,000 people. This performance was limited to 900. A couple of days prior, the city council in Zurich had determined that any performance requiring more than 1,000 seats would be banned. But the Opera House, being only 900, was allowed to proceed. And in fact, we enjoyed a wonderful performance at the Opera House on that occasion. Here's a shot of a wonderful space in the University of Zurich, a famous institution. Einstein taught there for quite some time. And you can see here the students aggregating, no face mask, eating their lunch, enjoying their freedom, and being unaware, it seems, of the danger they were putting themselves in. Now, the consequence of this is shown in the next slide. So here you see the incidence, the daily increases of coronavirus infection in Switzerland, beginning of March, rapidly increasing and eventually resulting in a per capita infection rate, which was for quite some time the highest in the world. Now, Switzerland only has a few million inhabitants, but the penetrance of the virus and the rate of infection was the highest per capita in any country for quite some time. In the next slide, I show you the opposite approach. In California, so the San Francisco mayor determined on March 16, little over a month ago, that residents should stay at home except for those who perform essential jobs and for those occasions when they had to meet essential needs. Gas stations, banks, grocery stores, pharmacies, of course, could stay open. Gavin Newsom, the California governor, then 3 days later issued the same mandate, a statewide shutdown of all economic activity, basically shelter in home, as it prepared for more than 19,000 hospitalizations. Very early in the game, and we'll see in a couple of minutes how this played dividends. On the opposite scale of behavior, Florida and other southern states, mostly red states, voting Republican and supporting the current president, did not institute such shelter-in-place orders. Only in April 2nd or so, the Florida governor, at long last, ordered residents to stay home to avoid the coronavirus. Then, of course, not much later, April the 3rd, Alabama and Missouri also chimed in with similar orders. And interestingly here, the Missouri Governor Parson issued a statewide order on the 3rd, but it wouldn't be effective until Monday, April the 6th. What is an additional 3 days? Now, it's a lot. Major things can happen in 3 days in this kind of exponential growth. So the next slide illustrates that the pattern of travel. Did people in fact stay home, or did they wander around and did the usual travel pattern? This data is obtained by anonymized cell phone data. Any cell phone can be tracked by location. This was done. The identity of the cell phone owners was not recorded, but rather the traveler movement patterns were recorded. You can see that in the southern states, Texas, Florida, Alabama, there is little decrease in the travel habit, whereas in the Northeast, New York, Maine, Massachusetts, etc., travel is shut down, as well as in California, as you can see. March 26, the travel pattern in the Southeast had not really decreased that significantly. People were still unconcerned, and that of course correlates with the late response of the governors to issue orders to shut down the economy and to stay at home. Now, this is now reflected in projections. The behavior of the government and patients' response to it, folks' response to it, results in different projections as to what might happen down the road. So here's the projection for California, which assumes that we may wind up with a total of 1,600 or so COVID-related deaths. Whereas in Florida, we expect about 4,357 deaths, related to the curve, the flattening of the curve, an expression that you have heard, that was accomplished successfully in California, but was missed to a large extent by southern states because of the late response, the denial of science, and the denial of the impact of mathematics and predictions displayed by the government. In the next slide, we show you some countries here. So mainland China, because of the massive shutdown and very intrusive social tracking of infected cases, was able to shut down the infection sometime in March. United States here, still in the exponential growth curve. Italy, a catastrophic growth curve, which now slowly is decreasing. So let's look a little bit more closely at Italy. As we were spending our days in Zurich, Switzerland, the first cases seemed to emerge, namely a person identified in the northern part of Italy, in Lodi, a province in the north close to Milan, was identified as having the COVID virus. Now, on day 6, after the initial patient 0 was identified, there were 322 cases and 10 deaths already. But the government was reluctant to freeze the region, which is Italy's industrial powerhouse. The mayor of Milan unveiled a campaign stating, "Milan doesn't stop."
I came from the mud, there's dirt on my hands. They sing on a sleepless night. Try to catch me howling at the moon.
On day 12, The Milan landmark cathedral opened back up to tourists. Some of the city's museums opened up as well. Cases continue to climb, topping 2,052 deaths. Day 18, a surge of new cases finally persuaded the government to lock down the northern part of Italy. You see here the lockdown area, but of course it was too late. And Italy has gone on to a major explosion of cases. So 47,000 cases and 4,000 deaths in the early phases of the pandemic. It got worse as time went on. So here's another example of postponing the action that science and math would urge you to implement because of exponential growth of this very infectious virus. It's not that people didn't know. It is that people disregarded the voice of reason and the voice of scientific evidence and went ahead anyway. And this is a very striking phenomenon, to disregard scientific evidence because of some other motivations, motivated reasoning. It's called a very powerful, destructive phenomenon of the human mind. Now, here is the idea of face masks. You have had many different messages. Face masks don't work. Don't buy them. We need them for our first responders, doctors and hospitals, etc., etc. These were recommendations from the CDC, the Centers for Disease Control, and they lied to you. They lied because, in this case, politically motivated reasoning. There was a shortage of face masks, and the government agencies did not want you to scoop up masks that were required and not available to first responders. The truth is, face masks do work. Here's the evidence. They will stop the spread of small particles, airborne droplets, which usually contain the virus. The virus does not travel by itself. It's only 130 nanometers, very, very small in diameter. It doesn't do well in the free air and in the sunshine. It likes to live in droplets of water or mucus secretions, etc. And those are of significant size and can be filtered by face mask. So if you should carry the virus and are symptom-free and you sneeze in a subway and you wear a mask, you're much less likely to infect those around you than without a face mask. You're also less likely to acquire the droplet from somebody who sneezes in your neighborhood not wearing a face mask, however you are wearing one. So on both ends, it works to some extent, and it's a multiplier effect. So in China, it's been very clear that if everybody wears a mask, the rate of transmission of the virus can be significantly decreased. Now, I will now have you look at two brief videos by one of my favorite thinkers, Yuval Noah Harari, who talks about government responsibility, our responsibility to the future, and that the future is not predetermined but open and determined by what we do and don't do at this particular time. So after you watch these two videos, I have you come back.
I think the worst thing is the disunity we see in the world, the lack of cooperation and coordination between different countries, and the lack of trust, both between countries and also between the population and the government. This is basically the payday for what we've been seeing in the last few years with the epidemic of fake news and with the deterioration of international relations. If you compare this, for example, to the 2008 financial crisis, which is of course a crisis of a different kind, but there are similarities, In 2008, you had responsible adults in the world which took a leadership position, rallied the world behind them, and prevented the worst outcomes. But over the last 4 years, basically, we've seen a rapid deterioration of trust in the international system. The country which was the leader previously, both in the 2008 financial crisis and also in the last big epidemic, the Ebola epidemic in 2014, and that country is the United States, now it's not taking any kind of leadership position. Actually, since 2016, the current administration has made it very clear that the US has resigned its role as world leader. It made it very clear that the US has no longer any friends in the world. It has only interests. And even if now the US, which is not doing so far, but even if it will try to assume a leadership position, nobody would really follow a leader whose motto is me first.
The really big problem is that over the last few years, irresponsible politicians have undermined the trust of the public in science, in experts, in the information they receive from public authorities and from the media. And now it's coming back to haunt us because in this moment of crisis, we need this kind of trust.
But what we're also seeing is something of a failure of international cooperation. So where do you think this leaves the balance between populist leaders and globalization?
Again, we need now global cooperation more than ever before to exchange information, to make sure that we produce enough equipment globally to deal with this, masks and testing kits and respiratory machines and so forth. We need a global effort to improve and increase the production, and we need to distribute the equipment fairly. It's not that the rich countries will monopolize all the equipment. We need the equipment to go to the countries that need it most. We can cooperate in many other ways by, for instance, sending medical help, medical personnel from one country to another. And of course, we need cooperation on the economic level to have a global economic plan, especially, again, for the poorer countries. Countries like the US, Germany, Britain, they will somehow muddle through. But when this crisis hits Africa, South Asia, South America, unless we have a global economic plan, entire countries could collapse.
Now, in a larger context, dear listener, this pandemic is just a minor rehearsal, a minor overture, an introduction, what is coming down the line. We had difficulty accepting science and math in this very acute, in-your-face pandemic with nightly newscasts of crying doctors, death everywhere, refrigerated trucks for the bodies that were accumulating rapidly. And still, we had difficulty drawing firm and simple conclusions. A very sad commentary on where we are in the US in terms of our government at this time. Thank you for your attention, and we'll see you soon again here at Behavioral Health 2000 for another presentation.